My dear friends, I am Dr. Colonel Brahmajit Singh from Hyderabad. I am a medical oncologist, that is, I am a cancer doctor and I treat all types of cancers with chemotherapy and the latest treatment modalities such as targeted therapy and immunotherapy. Do you want to prevent and protect yourself from cancer? Do you want to know what causes cancer? What are the risk factors, the warning symptoms, and how you can prevent and protect yourself and your family from cancer? And if you are a cancer patient, would you like to know what, when, why, and how of cancer treatment? If you are interested, press the bell icon, subscribe, and stay connected. What is there in cancer that compels us to treat a patient with systemic therapy? Systemic therapy, as I have told you before, is that modality of treatment in which the medicines that we give, they circulate in our blood and are therefore distributed all over the body. Is chemotherapy, which is a type of systemic therapy, essential, compulsory for treating cancer? Will chemotherapy prevent the cancer from coming back? What is the basis of giving systemic therapy? Is systemic therapy given in the form of chemotherapy worth it? Is chemotherapy effective in all stages of cancer, and does it work even in the fourth stage of cancer? Can chemotherapy prevent the complications that occur due to cancer? To understand the importance and essentiality of systemic therapy in the treatment of cancer, my dear friends, you must understand that why we have to give systemic therapy. Before that, we must understand how cancer spreads in our body. The ultimate aim of treating cancer is to kill all the cancer cells, which includes both the primary local tumor and the cancer cells that are spread to different parts of the body as metastasis and micrometastasis. If you want to cure the patient of cancer, that is, to make a patient cancer free. The sole aim of a cancer cell, my dear friends, is to multiply and keep multiplying till they overrun the entire human body. And in order to do so, they manipulate their local environment so that there is no dearth of nutrition and oxygen which they get from our blood vessels called arteries. A bit of biology here. We have two kinds of blood vessels, the arteries and the veins. The role of arteries is that they carry the oxygen and nutrition rich blood from the heart to various parts of the bodies, and the veins in their turn get this blood back to the heart from the tissues after the cells have taken up all the oxygen and glucose. And then the heart pumps this venous blood into the lungs where it gets oxygen, and then pumps this oxygenated blood to the entire body through the arteries. Slightly complex, but if you see the diagram you will understand. And this process, whole cycle, is called the circulatory cycle. Okay, so you must be wondering why I am telling you about the circulatory cycle. Actually, it's very important because the cancer cells use this very circulatory cycle to spread to the entire body. What happens is that the cancer cells start forming clumps. As they start growing and multiplying together, they start forming their own nests and colonies with the main aim to help and protect each other and fight against the body's defense forces, and gradually they form a visible mass which we call tumor. Tumor is like a potato, okay? So they form a tumor. So a tumor is a colony of cancer cells which have increased to such a large number that the lump is now visible to the naked eye. You will be surprised to know that 1 lakh cancer cells join together to form a tumor of 1 centimeter size. So the next time you see a tumor on a CT scan or MRI and the size is told to you, you can calculate how many cancer cells are there in that tumor. For example, if the tumor is 3 centimeters in size, it means 3 lakh cancer cells are in that tumor. Now, what happens is that as the tumor starts growing, it needs more and more nutrition and oxygen. So what does it do? It starts developing its own blood vessels, a process called angiogenesis, and starts taking over higher and higher amount of blood, oxygen and glucose through the arteries of the body. And what it does is that it starts shedding its cancer cells into the veins. So they reach the heart back through the veins, and from the heart then to the lungs, and from this lungs to the heart, oxygenated blood to the heart, from where it pumps to the different parts of the body. Thus the cancer cells, using our own body's circulatory system, spreads all over as micrometastasis. Micro means very small. They're basically clumps of cancer cells which cannot be seen with the eye. Creating these cancer cells then create the cancer nests, and then subsequently they increase in number and form visible tumors which are called metastasis, and they spread all over the body. So when you see a tumor which is around 1 centimeter in size, now you know that there are 1 lakh cancer cells in that tumor. But what is more important is that nearly an equal number of cancer cells have been shed into your blood. Among these, some of these cells, some have already found a place to multiply, and some of them are circulating and looking for places in the body where they can make their nests and start multiplying. This process of spreading of cancer cells is a continuous process. Now the question comes, how the hell do we kill these cancer cells that are circulating in our body? Few are visible as metastatic tumors, and many cells circulating in the blood are not visible to us. Basically, metastasis and micrometastasis. Local treatment, that is localized treatment, which I told you earlier, consists of surgery and radiation. Now, both these modalities can only be used if you can see the tumors. We need to know what to cut and what to burn by radiation. And it is understandable that we cannot operate or radiate the entire body. So, most of the tumors, by the time they are diagnosed, have already spread locally, involving the adjacent organs or the lymph nodes, or have visible metastatic tumors or invisible micrometastasis circulating in the body. Okay, I mentioned lymph nodes. Lymph nodes are very important. My dear friend, in simple words, lymph nodes are also known as glands. They are the forts where the army of our body train, stay and fight. And what do they fight? They fight infections and cancer. Most of the cancers are prevented by these army forts from spreading into the body. But once the cancer overpowers them, it gets a chance to spread through the lymphatics. Lymphatics, another medical word which you must know. See, the forts of the army of the body, which we call lymph nodes, are all interconnected by special highways, where we can say a kind of privileged highway is provided by our body to its army to enable its different type of soldiers to travel to different forts and anywhere in the body whenever required to fight infection and cancer. So these privileged highways which connect the various lymph nodes, that is the forts, are called lymphatics in plain simple non-medical terminology. Okay, so now the cancer cells, on reaching our forts, use our body's lymphatics to their advantage for spreading all over the body as they use our circulatory system. Now, in order to completely eliminate these cancer cells from our body, it is but obvious that we need to treat the spread of cancer through the lymphatics and the circulatory system, and that, my dear friend, is only possible when the medicine is given either in the vein, that is by an injection, or in the form of a tablet or capsule that gets absorbed and circulates in our blood, that is systemic therapy. I hope that you have understood now that without systemic therapy, we cannot eliminate cancer in totality. Surgery is done by the surgical oncologist and radiation is given by the radiation oncologist, and this is a situation where my role as a medical oncologist comes in, for a medical oncologist is trained and qualified to give systemic therapy, which may be chemotherapy, targeted therapy, immunotherapy and or supportive therapy. So all types of systemic therapy, chemotherapy, targeted therapy, immunotherapy is effective in all stages of cancer from stage 1 to stage 4, and this is also one of the therapies that prevents cancer from coming back, as they will kill all the cancer's nests and cells in the body and therefore also prevent the complications which are caused by the spread of cancer. I hope I have answered all your questions. Now, the recommendations for systemic therapy is different for different types of tumors. In few cancers, even in early stage, such as stage 1, systemic therapy is recommended. Whereas in most of the stage 1 cancers, the primary modality of treatment is local therapy, such as surgery or radiation. In all the locally advanced and metastatic tumors, such as stage 3 or stage 4 of cancers, systemic therapy is essential to prolong life, improve survival, prevent and delay recurrence, and simultaneously, most important, maintain the quality of life, all by preventing the complications due to metastasis. Presently, in order to provide the best treatment, a multimodality tested sequence of treatment is used, which is backed by evidence of multiple clinical trials, which may include all the 3 modalities, that is systemic as well as local therapy, such as chemotherapy along with surgery and radiation. I hope you have understood the significance and importance of systemic therapy, most essentially chemotherapy, which has stood the test of time and is also comparatively is more economical when compared to targeted therapy and immunotherapy. If you still have any questions, please feel free to ask in the comments section.